Hello folks, one more video, mini lecture to you. I hope you have been enjoying the lectures of this channel. Today we're going to talk about how autoimmunity may participate in the pathogenesis of retinitis pigmentosa. Retinitis pigmentosa is a group of diseases that share a similar pathogenesis. It is the main retinal dystrophy, and usually one or more genes are mutated or have a defect. Those genes are responsible for the production of a protein of a retinal cell, mainly the photoreceptors, and those proteins are key for the function of the retinal cells. As the retinal cells do not have the proper function of those genes, they may get sick and die. Retinitis pigmentosa usually compromises vision during adulthood, and patients manifest visual loss between 30 to 50 years old. They first have peripheral visual loss and ultimately may experience severe visual loss. So we know that the genetic change is usually inherited, but there are some evidences that autoimmunity or inflammation may participate in the pathogenesis or maybe even be a key factor in some patients. The first evidence of autoimmunity in the participation of retinitis pigmentosa is the association of retinitis pigmentosa with autoimmune systemic diseases like autoimmune polyendocrine syndrome or autoimmune thyroid disease. Fuchs heterochromic iridocyclitis is also more common in patients with retinitis pigmentosa. Another evidence is the presence of cystoid macular edema in a significant part of the patients with retinitis pigmentosa. One more evidence is that about 20% of the patients, the disease is considered sporadic. No genetic mutation is recognized. In addition, about 10 to 30% of the patients with retinitis pigmentosa may have subclinical or clinical mild uveitis with the presence of vitreous cells or other clinical findings. So all those clinical evidence put together show us that autoimmunity may participate in the pathogenesis of retinitis pigmentosa. Moreover, there are some lab research that have shown that, for example, necrosis is a finding in animals with retinitis pigmentosa-like disease. Also, the blood examination of patients with retinitis pigmentosa show higher levels of all anti-retinal antibodies and lymphocytes, which is another evidence of autoimmunity. In summary, we have lab and clinical evidence that autoimmunity may participate in a part of the patients with retinitis pigmentosa. I hope you enjoyed this discussion, and we are going to continue this conversation and these lectures in the future. Have a good day and evening.